If you've ever been told you have PCOS and then told your scan was normal, so it can't be that bad, I need you to listen to me right now, because the name PCOS has just been scrapped. And the reason why is going to validate everything your body has been telling you for years. Hi, I'm Dr. Sylvia, an NHS GP and women's health doctor. In the next few minutes, I'm going to answer 3 questions every woman with a PCOS diagnosis is asking right now. Does my diagnosis change? Does my treatment change? And honestly, does this actually matter? Or is it just a name swap? If you've ever felt that your symptoms were dismissed, this one is especially for you. Most importantly, I'll give you the exact sentence to say at your next GP appointment, so make sure you stay with me for that. So what's actually happened? In 2026, the Lancet, one of the most respected journals in the world, published a landmark consensus statement. It's the result of a 10-year global review involving 22,000 patients and experts. And the conclusion was clear. The name Polycystic Ovary Syndrome, PCOS, no longer accurately describes what is happening in the body. The new name is Polyendocrine Metabolic Ovarian Syndrome, or PMOS. Now, before your eyes glaze over at another piece of medical jargon, I promise this matters. This next bit is going to change how you see your diagnosis, particularly if you were ever told that your scan is normal and so you can't have PCOS. Here's the thing you probably didn't hear when you were first diagnosed. Most women with PCOS don't even have cysts, not real ones. The cysts we talk about on ultrasound, they're actually follicles, immature eggs that haven't developed yet. That's it. They're not the same cysts as you would find in someone with endometriosis or with ovarian cysts. And that word, cystic, has been doing real damage to women for years. Women have been told, you don't have cysts on your scan, so you can't have PCOS. Women have been dismissed, left without answers. Well, that ends now. The new name, Polyendocrine Metabolic, reflects what's actually going on. This is a hormonal condition, a metabolic condition. It affects your insulin, your androgens, your inflammation levels, your heart, your mental health. The ovaries are involved, but they're not the whole story. So, if the cysts were never the real problem, then what is? And what does this actually change for your next GP appointment? Let's get into that. So now the big question, what actually changes for you as a patient? Here's my honest GP answer. In the short term, the treatment itself doesn't change. If you're on metformin, the pill, or lifestyle management, that stays the same. The drugs haven't changed overnight, but here is what does change, and that's important. 1, how we diagnose you. The new framework for diagnosis is broader. This new name asks us to look at the new picture, not just compare you to a checklist that was never designed for you. More women will now qualify for a PMOS diagnosis, including women who were told that their blood tests were borderline or not quite PCOS. If you were ever told you don't meet the criteria, it may be worthwhile going back. Number 2, how your GP treats the entire picture. Under the old model, the focus was often on fertility and your periods. The new model asks us to look at your cardiovascular, that is your heart and circulation risk, insulin resistance, bone health, mental health. If your GP has only ever talked to you about your periods, this is your moment to ask the right questions. I'll give you those exact questions at the end of this video. 3, research funding and drug development. A clearer name means clearer research targets. Treatments specifically designed for the metabolic side of this condition are already in development. This rename has opened that door. Now, I want to be real with you for a second, because I ran a poll on this channel and some of you are already thinking, great, another name change, same old situation. Let me address that. Your lived experience doesn't change with the name. The weight gain that nobody took seriously, the hair loss, the irregular cycles, the anxiety, none of that is erased by renaming the condition. But here's what I want you to take away from this video. You were not imagining any of those symptoms. The science is finally catching up with what your body has been saying all along. PMOS, this broader, more honest diagnosis, validates everything you've been fighting to have recognized. And that matters. So, here's what to say at your next GP appointment. Write this down. I've been reading about the new PMOS consensus from the Lancet. I'd like to know if my diagnosis could be reviewed under the new criteria. And I'd also like to discuss if we can monitor my insulin resistance and my cardiovascular risk, not just my periods. That one sentence tells your doctor that you're informed, you're engaged, and you expect to be looked after as a whole person, not just a reproductive system. If this is the first time you're hearing about PMOS, type PMOS in the comment section right now. I genuinely want to know how many of you are learning about this here first. And if you've been diagnosed with PCOS and were ever told your symptoms weren't real, please share this video, because some lady who needs to hear this information may not know to look for it. I'll see you in the next one.